the
So
24 items the NDC wants to present to us when it comes to health, please.
I trust John Mama because why be paying? Now look, Baumia's manifesto did not talk about Confanoche, but John Mama is promising that he will rehabilitate Confanoche Hospital, which Otumfuo has taken it upon himself. So it's a very laudable idea. It means he thinks of the region. And so if he's going to renovate Confanoche and make it international standard, what else do we need? So let us trust John Mama to come and do good things for Ashanti region, which Kufuado and Baumia have failed at. We need to vote them out massively for John Mama to come and do good job for us.
Okay. So Kofi says he trusts John Mahama to deliver on his promises when it comes to the health sector. We have two Emmanuels on the phone line, but let me first speak to Emmanuel to answer. Emma, good morning.
Good morning, Eugene.
Yeah, please your contribution, sir.
Good morning to you, my fellow listeners. On the health issues concerning the NDC manifesto, I think we should have compared the current manifesto with the 2012 manifesto and see how many percentage of the 2012 manifesto concerning the health sector they were able to do it. Then we can really say, we can put our trust in the manifesto of the NDC. But as I see, I think they are all deceitful documents that they are giving it to us. Nothing can come out from this manifesto. Thank you.
Okay, so Emmanuel believes that this is a deceitful endeavor and he doesn't believe in it. Okay, let's speak to the next Emmanuel. Emmanuel, good morning.
Good morning.
Yeah, please your contribution, sir.
Yeah, I greet all of you. Looking at the manifesto of the NDC concerning the health sector, I think they've got good policies there. And as you panelists have said, those areas that need revision, I think the NDC should do that. And I really like the fact that they have provided something for nurses that are in the rural areas, because when you go to the rural areas, you find out that nurses are really struggling. So if they can do that to somewhat encourage them to stay there and take care of the people in the rural areas, I think it's very good. And the last thing I want to say is that concerning the Agenda 1.1 is a fancy policy, you know. We all know that Ghana, to the financial issues of Ghana has been a problem. And Akufo-Addo himself admitted. At first he said, "Tiskas were comedy," and then later on you heard him say, "Hey, so there are very important things. I'm not saying that Agenda 1.1 is bad, but when they try to introduce it, it's going to cause financial problems for the nation. So I think that one can be somewhat pushed to later years so that it could be looked at. Thank you.
Okay. I think the first Emmanuel was talking about the 2012 manifesto. You know, Leo Imani, every election year they pick the report. So last year, for example, the last election, they told that the MPP performed 56.77% on its 2016 manifesto. Now, when you go to 2012, Imani said the NDC performed 52.9% on the general manifesto, including all the sector. When it comes to health, they did about 80 to 84%. So I have to check the final. So they did about 80 to 84%. This according to Imani. Every election year, they pick the last manifesto of the ruling government and go through the various sectors and just oppose the performances against the promises. So this is Imani. So there's information for Imani also answer. Now let me go back to the phone lines and speak to Kofi Bedu. Kofi, good morning. Please your contribution, sir.
How are you?
I'm fine, sir.
Yeah. Also known as Muhammad Kandu, so do not allow anybody to deceive you. My good friend, look, this is NDC manifesto, and this NDC manifesto is not just a word on a piece of paper. It is a people's manifesto. So you looked at it one by one, taking care of. This is also known as Mahama Care, isn't it? Look, Baumia, like it or not, he is going to be pushed by Mahama to do more of the press engagement to embarrass himself for us to know his real color. Look, when you come to the free treatment for the kidney patient. That is where Mahama is focusing. That is going to give them free treatment for their entire life. Unlike Baunia, who wants to take advantage of these ill people to buy their vote. Mahama said he's going to give it to them for free. Thinking like this, and what else do you want? Look, Mahama thinks about those in the hinterland, the villages. That is why he's giving them cheap compounds and says that he's going to give the health workers an incentive, which is very important because none of them want to go to these villages. So this incentive is going to boost their morale to go there, have a family to cater for them so well. What else do you want? This is Mahama Care. So let us all embrace this particular manifesto from Mahama so that we push him forward. Thank you very much.
Thank you, Kofi Bedu. Let's go back and speak to Kwame. Kwame, good morning.
Good morning, Eugene.
Yes, please, your contribution.
I'm doing very well. How about you, Kofi? Eugene?
Please, I'm fine. I'm fine, sir.
Yes. We have had a chance to listen to the MPP and the NDC manifestos. And I would say these are brilliant promises. These are things, if as a country we had the money to do them, this country will definitely move forward. And we thank them for sharing these ideas with us. But I think what we should concern ourselves with the how. How many nurses and teachers do we have in the rural communities?
The numbers.
We are going to give them these incentives. How much will it cost us as a nation, and where will the money come from? You see, we don't have this kind of conversation, and they always get away with it. This time, let's just pin them down. Let them tell us how much each of the promises is going to cost, and where will the money come from? Thank you.
Yeah, it's a good one, Kwame. That's why we're trying to talk to them. But all the three spokespersons, Dr. J. Wapia, Honorable Kwame Minta Kando, Professor Titus, they all promised to speak to us, but they are not picking their calls. Maybe they have some emergencies and all that. So that's the question we wanted to ask them. That beyond the promises, there's the how are they funding it? But I have a message here said that you are doing a yeoman's job for Ghana. Our problem is MPP and NDC, and you have to end the duopoly this year. Help me wish my wife Elizabeth Owusu Asamoah a happy birthday from Nana Kweku Apia, who is a Brofuedru. Then another message also says that it's a lip service. I'm a senior high school teacher. Ghana under President Mohamed's watch. Payment of salary was even a problem. This incentive package for workers in hinterlands, it was in their manifesto in the 2008 elections. They won, but they didn't implement it. Enough of the MPP and NDC gimmicks. Please read my message. I read it. So that is that. He's typing again. I won't read that one. So you can call us on 0322083596, 0322083597, 0322083598. We are talking about the NDC, their health manifesto, the plan they have for the people of Ghana. If you give them the mandate, Joy 99.7 will be talking about food and the looming food crisis that we are facing because of the drought in the northern region, and what the agric minister is saying that we will not get back to the 83 levels. But before that, let me just give you some messages. Mommy, daddy, do you know why children leave home very neat and return home so different? I tell you, non-stop action, all the learning and sports burn energy. So those sweat stains, torn uniforms, and dirty shoes, they show that your kid has been active. That is why you need nourishment and energy at breakfast. So give them the nutritious Milo every day. Milo contains vitamin D that supports energy release to help their performance. Milo energy to go further. This advert